Hello, my name is Amir Nakhdjevani. I'm a consultant plastic surgeon here at Bellevue in Tunbridge Wells, and today I wanted to talk to you about tummy tucks. Some of you have had some questions about the procedure and want to know whether it's suitable for you and what's the difference between a tummy tuck and liposuction. So in order to illustrate this better, I've got some images for you to understand what tummy tuck is and who is it suitable for. The first picture demonstrates when a lady is going through pregnancy, and you can see as the child is developing in the abdomen, it distends the abdomen, it damages the skin in the form of stretch marks in some people more than others, and some of that is to do with your quality of skin and your genetics. It separates your abdominal muscles to allow the growth of the baby, especially in the third trimester. So once the baby is born, there will be some residual changes in your tummy, as you can see here, in the form of wrinkling, stretch marks, poor quality skin that doesn't shrink back. You can see the muscle separation here and here, where although the muscles sit side by side, they're not interlinked like they used to be. And sometimes a little hernia, a weakness in the wall where the bowel pushes through. So quite often the ladies, after having kids, they're going to be left with some loose residual skin that doesn't shrink. Now for these people, there's a number of things that needs to be corrected. The muscle separation that needs to be stitched back together, extra skin that needs to be removed, and some of the fat that needs to be removed. Doing liposuction in a patient like this wouldn't be suitable because it doesn't address the muscle. It doesn't address the loose skin, and taking some fat out through liposuction is going to leave you with looser hanging skin and possibly wrinkly skin, which is aesthetically undesirable. So if you look at this picture, this demonstrates how the muscles are pre-pregnancy, and after pregnancy the abdomen distends and the muscles separate, and this creates a weakness in this area of the tummy. Now, as part of the tummy tuck procedure, we stitch the muscles back together. And as you notice here, it pulls the waist in because the muscles come together. As you can look at the previous one, you've lost that contour and definition of the waist. So this is an example of a patient of mine where we've marked before a tummy tuck. So you can see the skin is quite damaged because it's been stretched. So we're removing this area of the skin and fat, and as a result of doing that, we go under the skin to repair the muscle together. It's going to pull her waist in, and it's going to pull that skin tighter and lower down, so she does not get this appearance where there's protrusion of the abdominal content because the support structure of the muscle is gone, so that she can be flatter with muscle tightening, and the loose skin that no longer is retracting can be removed. So an example of a patient of mine is this lady who was a mum of two, and she underwent a mummy makeover, which typically deals with the breast and tummy at the same time to put their body back to how they used to be pre-pregnancy. And you can see 2 years on, she's gone from having loose skin, poor muscle tension, and lack of definition where she's got these bulges on the side to a much smoother contour, nice definition, nice belly button, and flatter contour. That's really what people are after. Now when we see people, some people like this lady is very thin. She's got very little fat under her skin, but the entire protrusion is because the muscles have given away far more than other people. And just by tightening the muscle and removing the skin, we're able to achieve such a result. In this picture, you can see we sometimes combine liposuction with tummy tuck. So this is a lady who's in her mid-40s. She had 2 kids. She was left with stretch marks and loose skin of the lower abdomen. So we did a tummy tuck to remove this damaged skin and tighten her muscle to pull her waist in. But we've also then supplemented this outcome by doing some liposuction to create more curvature here, giving her an hourglass and giving her a bit more definition so that she looks nice and toned. And you can see from the side, the reason this is no longer protruding is because the muscle tightening has flattened her abdomen and giving the liposuction has given her that lovely waist. Now, when you have a tummy tuck, you go from this appearance where you've got excess skin and fat and the muscle separation to, during your recovery, you start to see some of the shape here, but you can see a few months later the swelling's gone and the shape comes out more. And the idea of the tummy tuck is to make sure that the scar's hidden under the neckline and a small scar around the belly button that is gone inside the cavity and is not visible, giving you a much more toned look, tighter skin, tighter muscle, and much flatter tummy. And having had liposuction in this lady would be the wrong thing to do because she has too much loose skin. You can already see the rolls here. And taking more volume out is almost like a balloon that's been deflated. You end up with irregularities and poor contour, kind of a cellulite appearance. So it's important to address the skin, the fat, and the muscle, which is done in tummy tuck. Whereas in liposuction, it only addresses the fat, doesn't deal with the skin that's lost elasticity or the muscle that's been separated.